Hi, I'm Dr. David Greene, CEO of the U.S. Pain Network, where we connect those in pain with pain management clinics around the country. Today the topic is the 5 key points with epidural steroid injections. So the first key point is that these injections have been around for over 50 years. A lot of people don't realize that, but they've been doing epidural injections for pain relief either by orthopedic doctors or pain management doctors for over 50 years. It's been unbelievable. And there's a reason, when a procedure's done that long, there's a reason. It's because it works well and the risk profile is very low, okay? So the second key takeaway point is the premise behind why epidural steroid injections are done. They're not administered to fix the problem that you have, okay? They're a Band-Aid on the pain situation. So if you have a disc herniation, let's say this is a disc herniation pushing on a nerve root, this causes a lot of inflammation. It can cause sciatica pain to shoot down your leg. But if you inject steroids around this area, it can bathe it with soothing anti-inflammatory medication, and it can give you pain relief and give it time for the body to disintegrate this piece of disc that is pushing on the nerve root. Okay? So it's a Band-Aid effect. All right, that's the premise behind these injections. The third major takeaway, key point, is that these are very low risk procedures. They're not risk free, but you're talking about less than a 1% risk of infection, allergic reaction, maybe some bleeding. Usually if you take anti-clotting medications, that risk is higher, so you're supposed to stop those 5 to 7 days, prior to the procedure. And another risk would be from the steroid. You can get a temporarily increased water retention. Your sugars, blood sugars can go up a little bit. That's usually transient. Okay. Now the fluke we had last year with the fungal infections from epidural steroids, that was just that, a fluke. We haven't seen that before, and I doubt we'll see it again. But the risk of infection is much less than 1%. And of all complications with epidural steroids is less than 1%. So the fourth key takeaway point is that it's often necessary to receive a series of epidural steroid injections. Oftentimes this can be not just 1, but 2 or 3 injections to get the optimal amount of pain relief. Okay? So if you have a disc pushing on a nerve root, the first one may give a little bit of pain relief. It may be necessary to get a second and a third over a period of 4 to 6 weeks to get the optimal amount. That series can be repeated every few months, but usually it's not done more than that because pain doctors don't want to give you too much steroid and cause issues with that. Okay? So the fifth takeaway point is how effective these injections are. There's been dozens of studies over the last decade looking at epidural steroid injections. Now, what you find is that when fluoroscopy is used, which is the real-time X-ray, these injections are 75 to 90% good to excellent results. They can help people avoid surgery. There's one study looking at professional athletes and how effective it was at getting pro football players back on the field. It was 85, 90%. Okay? So oftentimes they can really help you with a low risk profile and high reward with avoiding surgery, getting back to work, playing with your kids, things like that. And you give the disc herniation time to disintegrate. Okay? So there's the 5 key takeaway points. Pain doctors that we work with are typically board certified, often fellowship trained, and they have a lot of experience with doing epidural steroid injections. So visit our website at uspainnetwork.com. There's a ton of information on pain conditions and treatments. There's also a database, so if you put in your zip code, it'll show you the pain clinics that are closest to you to receive treatment for obtaining pain relief. I'm Dr. David Greene with the U.S. Pain Network. Your pain stops here.